I'm Ms. Weng Aguilar Laplind, and I'm your Motianang Pilipinas, Pampanga Provincial Director. And I'm here right now at CSA Medical Aesthetics to do some procedures again by Dr. Contessa. April 2022, Dr. Contessa did some procedures to me. It's the derma filler and the facelifting using cog threads. And that was on April 2022, and as you can see the effect, it's been like 12 or 17 months, still have the effect. And many people are asking me, ito na po yung pagkakataon to answer those questions from many people, why I look younger than my age. And ito na po yung kasagutan. And today, I am here again to do another facelift using cog threads and lip enhancement. As many people notice that I have a very thin lips, you know, and I hate it sometimes. And according to Dr. Contessa, my beauty critic, sabi niya, she can make me look more beautiful by undergoing that procedure, which is the lip enhancement. And don't forget to subscribe and click the notification bells.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. Let's all welcome back Ma'am Weng Laughlin. Hi, Ma'am Weng.
Hi, Doc. Nice to see you.
Right. So in the past, we did a cog thread lifting for her via this vector here. We call it the lateral vector. Okay, and we were doing some lifting on the mid face as well as on the lower face to kind of reshape the face. So how was it, Ma'am Weng?
Oh, it's been 17 months, Doc.
Yes.
Actually, I've been here like April 2022.
Yeah.
And you can still see the effect. And many people talaga, Doc, are asking, anong ginawa ko? Because I look younger.
Right.
Like 10 years younger or more pa.
Yeah.
So, and this is the answer.
Right.
Siyempre.
So, actually, Weng was sharing with me that a lot of people were noticing changes on her face, but they cannot really pinpoint exactly what she did, okay?
Exactly, yeah.
So, it's the rejuvenating effect, like taking away 10 years from you, right?
Or more.
Or more, right? And we just did those techniques of like lifting using our absorbable PDO cog threads. Okay, so we are so happy for Ma'am Weng. And then after that, you were just doing some, you know, for the forehead, exactly, Botox injections to treat the wrinkles, and a little bit of some fillers on the nasolabial fold to kind of soften and improve that area there. For today, we wanted to do something for Ma'am Weng also, of course, to maintain the effect of that lifting. And reshape the face also, contour the face again, okay? So actually, Asian face were really known for having that round shape, okay? So we're kind of like wider laterally. And somehow we wanted to narrow the shape of the face, a little bit elongate it, or the others are wanting the V shape or the V contour. Although ideally, for women, it's fine to have that like oval shaped face, okay? Like more of a feminine look. Okay, the others wanted that very sharp V contour.
But in the Philippines, they like the V shape.
Yeah, the V-shaped thing, okay? So, you wanted to kind of like elongate your chin and also kind of like narrow this side here. For now, we'll still do a treatment that we call like a V contour using our cog threads also. We're doing another lifting for her. Pull these sides here and lift the nasolabial and as well as the jowls. And I want also an approach that we call the vertical vector. We'll be doing a combination approach for that. And I want to also do some soft enhancement for the lips, okay? Natural, soft lips.
Finally.
Appropriate for our age, okay? We're not into like you know, the others like too much of that plumpness there or too much of that pout on the lips. Okay, we just wanted something to, of course, prevent the aging around the lip area. Some people have these lip lines already, or the inversion of the lips, or the volume loss, or the loss of the contour. The borders are already kind of like not so defined. Okay, we just want a natural soft enhancement for the lip area for our age. Okay, okay, Ma'am Weng, we're
Yes,
excited.
I'm
We'll
excited.
show the procedure when CSA Medical Aesthetics return. And we're back. So we're doing procedure for Ma'am Weng. So it's the cog thread lifting and also some lip enhancement there. Now, before we do the procedure, okay, we have to check for some vital structures like your blood vessels and some tissues that we want to look like. If I want to work on the temple region, so I have here my Sono Finder here to visualize for the vascular tissue here. Like for example, here you're looking for the superficial temporal vessel there. So I can see some of the subcutaneous tissues and some of the muscle here, the temporalis muscle there. Okay, if I want to check on the blood area there, so we can see some color in the picture there, and we're seeing location of our vascular tissue. And I'm gonna go posteriorly, checking on some. Okay, so here I'll be avoiding some of those vascular tissues there, so that we don't have any complications. But actually, with filler injections, it's very vital that you know where those vascular tissues are. Okay, so I wanted to stay in the subcutaneous plane when I do my injection for my thread. So we'll avoid this layer here where you have a lot of blood vessels. Okay, so since I'll be working also on the so-called lip area, okay, so we'll be back with the B mode there. So here area, I want to locate here the facial artery. So first, let me just position my Sono Finder here. Okay.
Is it like ultrasound?
Yeah, it's an ultrasound where you see those tissues. So this is safe, okay?
That's cool.
There's no radiation coming out. So here, so we're expecting some tissues here, muscle, subcutaneous layer, okay? If I want to go deep or want to go superficial. So we just want to locate for some significant structures there, okay? What I want to see is where the facial artery is that supplies also the lip region. So lip region, we have the labial blood vessels, okay? So I'm seeing it in this deep plane here. So when you go up there, it's gonna change in its position. Okay. So basically, we want to avoid areas, okay? So ideally, when you work on filler injections, you have to really go on the safe layer where you wanna inject your product material. So we'll clean the area again, remove that gel, okay? So I'll be starting on injecting the cog threads for Ma'am Weng. And for that one, okay, clean the area, then put your numbing cream. A while ago, they already applied the topical anesthesia, okay? So we'll also inject again lidocaine for numbing of the area. And I want to follow my lateral canthal line here as well as the line of the eyebrow tail here. So I'll do a so-called vertical vector here. So this is the first one here. Ma'am Weng, this is just the lidocaine, okay? So we'll make 2 entry points for my vertical approach. And then I want to pull again the mid-face section. So we want to improve your nasolabial fold. And then we'll also be doing the so-called jowl lifting here. So for the nasolabial fold, we'll be doing the so-called numbing of the infraorbital nerve here and then mentalis nerve here, okay? So I'll also use my cog PDO threads, and I'll be applying the so-called 21 gauge type, okay? So what we'll do is attach the lidocaine in that cannula of the cog thread, okay? Sterile OS. again, your cog PDO thread, 90 millimeter length. Okay, gliding it towards the lower labiomandibular fold. So actually, this part here, there are some resistance. I can push my Lido again and go advance it towards that lower mandibular fold there. Okay. Some tissue resistance, Ma'am Weng. Okay. I noticed Ma'am Weng's pigmentations, right, kind of decrease also with the cog that we did, right?
Okay.
Because of the stretching, you're targeting superficial melasma. Stretching of that skin can help you get rid of those epidermal melasma. Okay. Plus collagen reformation and regeneration can improve further. Okay. So some resistance that I'm expecting here, because sometimes you have tissue resistance already because of some fibrosis there. And there you go, we are already advancing further. We'll push again some of our product there, the lidocaine there. And advancing to that and pulling it out. And we can cut already, okay? So there you go. And this is right side cog thread lifting. So before we proceed to the left side for cog thread lifting, we'll also be doing the lip enhancement. So I just have a pain freeze here to numb the entry point for my lip injection. So I'll be doing a so-called cannula method. I'll pinch this area here, okay? As much as possible, I want to be near the corner of the mouth. So I have a cannula there, here. So this is a soft lip filler, okay? And I was explaining to Miss Weng, we wanted to start with something like a minimal, just a tiny or not so much, okay? So we want to do some natural soft enhancement. So I'm just gonna glide it towards the vermilion border, okay? So this is like a cannula, soft cannula, and we just wanna reach this part here, okay? So this is a good substance. I'm using the so-called art filler here, European brand, Ma'am Weng, okay?
Okay.
And it's manufactured by the so-called Filmed, okay? I'm just gonna go to this upper lip right side area here and push a little bit, just a gradual push, okay? Just slowly, 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 okay? Slowly, slowly, slowly. And then I'm gonna go to the lower lip. So I just kind of push a little bit, like 0.2 mil. And then we'll go to the lower aspect, okay? So when you do this cannula method, okay, you should be in the right anatomical plane, okay? As we age, Ma'am Weng, our lips really will lose volume. So we also want to restore the volume, and we wanted to invert somehow the lip region. So right nowadays, we have procedures we call lip lift, okay? So I'm crossing the corner of the lip, okay? So I just want this to go. So this one is going to this side here. Or if you have a very short cannula, you can make your entry point near the oral commissure, okay? So I can actually push a little bit here. Gauge 25 of my cannula, for those who wanted to know what's the gauge. It's a gauge 25 cannula. So I will inject into the body of the lower lip, okay? So we'll be using 0.2 for the upper right. You can use 0.3 for the lower right, okay? You're still good, Ma'am Weng? Okay. Gonna go back again. Okay. So we're just gonna go to the body of our lip area. Ma'am Weng has really lip that is for a young person. Kind of like the size, if you look at the size. Petite. Right, Ma'am Weng? Petite lip. That's fine, okay? So I'm already exiting this part here. I can add a little bit more on the upper lip just to enhance further and go at that vermilion border. We wanted to enhance. There you go. I'm on the vermilion border. We wanted to enhance this part here. Okay. And prevent also lip lines. We want to have those barcodes on the upper lip. Okay. So let's go to the left side of our lip region. Okay, so that's done. That's actually quick procedure. Okay, so we're doing the left side. Okay, so pain freeze just to numb the injection entry point, and then after that we'll make this puncture. So we have done cog thread lifting and also lip enhancement. We'll show the result when CSA Medical Aesthetics returns. And we're back, so we'll now show the result to Ma'am Weng. And here's our mirror, Weng. Okay.
Magic mirror.
Yes.
Yes. Wow.
So we did the cog thread lifting. Like we had combination lateral vector as well as the vertical vector, and we had some minimal lip enhancement for her.
Galing,
So
Doc.
how was it? Yes.
Instant effect, oh.
Yeah.
Yeah.
Actually, I can notice already the lifting
the
here
lifting.
on the mid face as well as the lower face, and we were able to kind of make her face slimmer, narrower. Because the vertical vector, I like it in doing like that narrowing effect of the face. Plus, I noticed the eye area, the corner of the eyes, they were also lifted because we did lifting from the, like a line, horizontal line from the tail of the brow. So it opened her eyes too, okay? And then the lips, they're so natural, just a soft enhancement, appropriate for our age. Right, Weng?
Sure.
Yeah. So for how's the experience?
It's not that painful that I thought. No,
Because we had the numbing, we had the lidocaine. Like during the insertion of those cog threads, we were pushing some of the lidocaine solution. Although sometimes I do the individual or multiple injections of lidocaine.
But it's tolerable. Yung
It is
injection nga lang
tolerable.
yung mapipil.
Right, yeah.
Pushing of the thread, hindi ko na.
It's numb.
Yes,
Right.
because it's numb.
Yeah. And then we just expect you to feel still numb up to now because we did infraorbital nerve block and mentalis nerve block. It's like the sensation that you went to your dentist and done some
parang
dental
numb ng konti.
injections there, okay? So here you go. So we have Ma'am Weng. So experiencing another cog thread lifting. It's been like 17 months from the first time she had it, but we still see the result from the previous one. So this is just like a maintenance treatment for her. At the same time, preventing aging, treating aging, delaying aging process, because this aging is physiological, it happens, and you'll just notice in your face some tissues going down, they descend, and some grooves there, hollowness there, volume loss there, thinning of the skin, and all of those aging processes. So we wanted to do something about it, okay, and wanna, of course, be confident about ourselves, and we wanna look at our, like, the best version of ourselves, right?
Yes.
Yeah.
Thank you, Doc.
Thank you, Weng.
Thank you, CSA.
Yeah.
Of course. in CSA, you
Yep.
know, empowering beauty.
Yes,
It's
and
empowering you.
Exactly. And then if you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. So, Ma'am Weng, if they have like some questions on the procedure, can they reach you in your Instagram?
Yes, of course. This will be on YouTube, right?
Yeah, right.
And then it will be posted on my Facebook, Weng Aguilar Laughlin.
Yes.
And pa-plug ko na rin, Doc.
Yes.
Yung Mutya ng Pilipinas, Pampanga
Yes.
po. Our
Right.
coronation night is on November 4. And of course, one of our generous sponsors is CSA.
Yeah. It's an honor to be a part
Yes.
of that event, okay?
Thank you
And
po.
our other videos, please watch them at our YouTube channel. Contessa Salvador, Ma'am Weng also has
Yes
previous
po.
episodes, right?
Yes
Not only
po.
one, okay? So, and thank you for all those who have already subscribed. So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.